Broad ligament hematoma is potentially a life-threatening condition which needs prompt recognition and management according to the hemodynamic stability of the patient. Assalamu alaikum everyone, how are you all? This was the exam scenario. A multiparous woman delivered and presented to you in the shock. On pervaginal examination, the uterus was tilted to one side. First, we will cover theoretical aspects of broad ligament hematoma, like what are the risk factors, difficult vaginal delivery, instrumental vaginal delivery, cesarean section, and uterine rupture. What are the types of hematoma? Stable or non-expanding, which has contained bleeding, and expanding hematoma, which has active bleeding and it is a dangerous one. Signs and symptoms depends upon the amount of bleeding, like lower abdominal pain, pelvic pressure, signs of shock like tachycardia, hypotension, pelvic pressure, tender pelvic mass, and uterus displaced to opposite side. On pervaginal examination, fullness in the lateral fornices. Clinical suspicion is the key, like exam scenario, and on ultrasound there is pelvic collection, and if patient is stable and diagnosis is not clear, then we can go for CT scan or MRI. Management point of view, if patient is stable, hematoma is small, go for vital monitoring, IV fluid management, blood transfusion, and IV antibiotics. Expanding hematomas where patient is also unstable, go for resuscitative measure A, B, C, and go for surgical exploration. Uterine artery embolization is also one of the options. Surgical options include evacuate the hematoma or identify the bleeding vessel and ligate that vessel, or stepwise devascularization, which includes uterine artery ligation, utero-ovarian ligation, and internal iliac ligation. And then hysterectomy is the last resort. There is a quick mnemonic: pain and shock and pelvic mass. Think of hematoma. Now we will quickly do how to approach this station in exam. In the beginning, I have mentioned the scenario. A multiparous woman delivered and presented in shock. On pervaginal examination, uterus is tilted to one side. So this is a hint. Whenever there is hematoma will press on the uterus and uterus will be shifted on the opposite side. Like hematoma is of right side, then uterus will be on left side. Take a quick history after reading the scenario, like parity, mode of deliveries, previous mode of delivery, recent, and use of instruments, or cesarean section done, or history of any uterine rupture in order to rule out the risk factors. And then you will go for the examination finding. You will ask for the vitals, per abdominal, per vaginal finding, and then investigation. Investigation starting from the baseline, specific investigation like ultrasonography, CT scan, and MRI. Treatment is an individualized plan, starting from the conservative, then uterine artery embolization, and then surgical options. As in this scenario, patient is in shock, and on examination, you have suspicion of broad ligament hematoma, and in ultrasonography, you have found the collection. Go for the exploratory laparotomy at once. The examiner about the surgical options, as we have discussed earlier. But if examiner asks you the systematic way how to approach the hematoma in stable and unstable patient, then you can tell all the management options. Short, be simple and accurate. Then your viva or station will go smooth. Thank you everyone. Take care.